conversation. Welcome to Little Horse and Big Conversation, where we give them their say, let the horse guide the way. Here at Little Horse and Big Conversation, we have the choice, so let's give them a voice. Here at Little Horse and Big Conversation, Little Horse and Big Conversation.
Hello and welcome back to the Little Horse Big Conversation podcast. You're here with me, Ross Cooper, and my co-host Amy Mitchell. And today's topic is, it's a little bit more somber than recent episodes. It's unfortunately something that we can all relate to. And specifically why I wanted to bring this to the table today is due to my own recent experiences, and with that being quite present in my own mind, it really makes you appreciate the value of talking about things that we're going through, which I think we all collectively need to do a little bit more of. So, talking about how we can navigate grief, which of course is going to be the topic of today, and by extension how we can help support others, and consideration to how we can support our animals, our dogs, our horses, because these are all really important things that we need to consider. And it is important, but it is also a difficult conversation to be able to have. I don't think with conversations like this there's ever a right or wrong, but I think between Amy and I, we can hopefully offer something for someone to take away. But I think talking about these kinds of topics, or even listening to them, can be quite healing.
Yeah, I think so. It's not, it's not an easy thing, but it's something that we all experience. There's no getting away from it. And you know, everyone experiences things in their own way. There are obviously themes. Research shows various phases that we're likely to go through, but that we might go through them in a different order and to different, you might get stuck in one phase for longer than another and so on. But at the end of the day, it is something that you can't bypass. And I think if you're someone who's quite good at shutting down your emotions, that's not a healthy thing. And being able to work through your grief in whatever format that it takes, I think is really important.
Because the five stages, I've just had a quick look on the internet because I was aware of, I think, about four of them, but it
Yeah,
always throws me with the middle one. So we've got denial,
yeah,
we've got anger, we've got bargaining,
yeah,
depression, and then acceptance.
yeah,
And like you said, it's, people experience those different stages to different extents, with different emotions, with different behaviors, and there's not a set time limit for one person to go from D to A, so to speak.
yeah. And sometimes something will years later, you think that you've reached acceptance, and years later something happens that triggers a memory, and it all comes flooding back. I still find my first German Shepherd, photograph of him, suddenly I've come across it on my, it's before the days that we all had phones in our pockets and we're taking pictures every 5 minutes. But if I'm going through my laptop trying to find a file of something, and I find a folder of photos of him, it's still a punch to the gut. But hopefully you reach a point where you can kind of try and focus on the good things that happened, and the positive memories that you have, and that kind of thing. Um, but yeah, it's a tricky one.
I think one aspect of of this is especially with our animals, whether
Yeah.
that be horses, whether that be dogs, whether that be cats, we form such strong relationships with our own animals
Yeah.
that during the process, you know, how do we go about that? I mean, me and Amy have had the conversation so many times that I think last one of the last decent things that we can actually do for our animals is to let them go with dignity when they're free of pain. One thing that really, really, really irritates me is when people, especially when it comes to horses, they're in the field, they're grazing, they're eating, they're upright, they're fine. That's not that's not necessarily the case. You can have a
Mm.
horse which is in such a bad way and they will still try and eat. Obviously, it differs with each individual. Pain is expressed very individually.
But I think there is also another level of kind of nuance to this, in
Yes.
that has the animal reached a point where they feel they've got nothing to live for? Like, is the desire to live still there? Because
Yeah.
sometimes the animal can be in pain, but they've still got that fight, that desire to get better, and it's that you can still see that
Spark
desire
also.
for life is there. Whereas you can look at another animal that potentially is not in the same kind of physical dire straits, but they've checked out.
Yeah. No, I agree with you there.
Yeah, it's a tricky one. And then how can we be the arbiter of that? Like, this is always the perennial question, isn't it? People always, like, it's such a difficult. Well, I mean, sometimes it isn't. Sometimes, your horse has got a severe colic, and or has broken its leg severely, and there's no decision to be made. You just do the right thing. But it's those grayer areas, isn't it, where, like, and I know, people. This is so. I'm going to tell a slightly mad sounding story here. People that know me well, I will have probably told them this story. To some of you out there, this might make me sound like an absolute nut job, but I stand by it. So my thoroughbred that I had, Mary, my ex-racehorse, a life-changing horse for me. She had a liver tumor, and we'd tried the I had an amazing vet when I was down in Cambridgeshire, absolutely superb vet, and it tried everything really to help her. But her symptoms were such that you'd see her one day and she'd look in a lot of pain and she'd look utterly miserable, and I'd think, yeah, okay, the time has come. And then you'd see her a day later and she'd be acting like a spring chicken. Like, look like there was nothing wrong with her. And it was it was really quite distressing, because I'd got to the point where I'd had a conversation with my vet, and we'd kind of reached the end of the treatment possibilities and agreed she's not going to get better. We're heading towards winter. We need to be making decisions. So, right, okay, I'm going to give her 2 weeks. And at the end of that 2 weeks, that's when I'm going to have her put to sleep. But during the first stages of those 2 weeks, she was still doing this, like having days when she looks really good. And I would look at her and think, God, what am I doing the wrong thing here? And like questioning my motivations and thinking, is there a part of me that wants to let her go because it's so hard for me dealing with her suffering and the struggle and the flip-flopping and the never knowing quite what I'm going to see? Is there a small part of me that almost wants that to be over? Um, and then seeing her looking well and thinking, oh, this, I'm doing the wrong thing, that she's not as ill as we think, and I can't take, like, this vibrant creature. And I swear to God, she helped me out with that decision. I swear she did it on purpose because a few days before we were coming to the end of the 2 weeks, um, I'd taken a friend with me to come and see her, to kind of say goodbye to her, really, and to come and see her. And I got to the yard and she was non-weight bearing on one of her hind legs, which was a new symptom. And her other hind leg was shaking, like you could see the whole muscle shaking, and she was clearly in a lot of distress. So I phoned the vet and said, "Look, just come out. It needs to happen now. Like I can't have her suffering like this any longer." And he came out, and she was put to sleep that night. But I've always felt like, because I feel like she and I developed a really strong bond over those last few months. I would go and sit in the stable with her for ages, just to spend a bit of time with her. And I feel like she did that to make me feel okay about it. I feel she made the decision. Now's the time to go, and I want you to feel okay about it. And I know that sounds nuts.
It doesn't sound nuts.
I will always maintain that that's what happened.
Have you come across soul contracts before?
No, no.
So it's more of a, like a spiritual concept about souls making agreements before they incarnate,
Right.
which sets out. See, if you thought you sound nuts, if the
Yeah.
wrong people are listening to this, now I sound nuts, but we're cool with
Go with
that.
it.
So it's already sort of like a pre-planned aspect of them serving a purpose or fulfilling their contract. So I think some, and that can manifest in lots of different ways, but sometimes the way that they leave can be a part of that soul contract. But I also think the soul and the spirit of that individual, person, animal, I very much believe that they have they have a decision in when, in
Yeah,
certain
I think that's
circumstances,
true.
like you say, nuanced.
Yeah. Yeah. I think that's true. And you hear that so often from, nurses in hospitals, and that the person will hang on either until a loved one is there, or sometimes the flip side of it, until the loved one isn't there. And it's like they make that conscious choice.
Yeah. As we know, that's recently happened for me.
Yeah.
So so my grandma has been ill since what was last June, and she was diagnosed with heart failure and multiple organ failure, and she was given an end of life prognosis of 3 to 4 months, and that was back in June, middle of June, I think it was, and she passed away 3 days ago, which makes us doing this topic now quite poetic, but also a little bit raw.
Mm,
And I've said before that I got a I got a I got shown how she passed,
mm,
and that's how she went.
mm,
But the synchronicities that surrounded when she passed, it was a full moon, and we went to see her on the Saturday night, and because she's had multiple strokes and a few seizures when she's been in nursing care, um, she has, of course, been quite confused at times, not massively coherent in terms of having having a conversation. But when we went to see her on Saturday, she was the most coherent she'd been for at least 6 or 7 weeks. And she'd had a conversation with my dad just before I got there, and also with my other half, Natasha, when me and my dad left the room. And so Tasha's a nurse, and she deals with this sort of thing all the time. So she's very good at talking about death very openly. And my grandma was effectively saying that she's lasted longer than what she thought, but she's not scared. and she's ready. Now, a couple of days before, when I'd been speaking to my dad, the nurses and the care staff had picked up on the fact that she was feeling and starting to sound a little bit mucusy in the chest, which that's the
Mm.
heart, that's the fluid involved with not effectively being pumped around the system. But you can get something in people called a death rattle,
Yeah.
as you know, when they get to a point where their passing's imminent. And I said to my dad over the phone, "Is it a rattle?" And he
Mm.
said no. Now, no one had relayed this word to my grandma. And then when we left on Saturday night, I went, I'll see you in a couple of days. And she looked at me, and me and my grandma have had quite a relationship over the years. And there are times when she would look at me like I knew what was happening because she
Mm.
knows I'm that way inclined.
Mm.
So it was a different kind of exchange. And the energy in that room felt very different. And she just said, if I'm still here, I'm rattling, you know?
Mm.
And no one else had used that word. Now, I've been pretty much sleeping with my phone on Do Not Disturb for next to next to 5 or 6 months, and I've not actually had it on Do Not Disturb for quite some time. But that night I did. I just felt that's what I needed to do. And then I got a phone call at 4:30 on Sunday morning, and my dad obviously said it's not looking good. Um, and I made the decision to head over. But I got dressed and got downstairs, and something caught my eye across the floor, and it was white. And I thought, oh, it's maybe a little bit of stuffing from one of the dog toys. Bear in mind, there was no breeze, and I picked it up, and it was a white feather.
Mm.
Which white feathers do have spiritual significance. And at that point, I literally just felt there's no point in me rushing because she's left. And when I got there, she probably passed about 15 minutes before. But she very much made that decision.
Yeah.
And it's one of the few times. I mean, I won't say I've been fortunate enough that I've obviously lost family members. But it's probably the first time that I've had an experience of someone so close to me dying that it's actually felt so peaceful.
Yeah.
Just everything. I mean, it was a beautifully still day on the Saturday. It was,
Yeah.
it was a really gorgeous wolf moon. When I left the care home on the Sunday morning, it was a deep orange sunrise, and then it was a blue sky day with flurries of snow on the Sunday. But just everything felt so tranquil, and how she passed, her heart literally just did stop. It was just all the whole transition of her passing was so seamless, which she endured more than what she should have done, but for whatever reason, that was the time she decided, which she very obviously did, which, it doesn't surprise me about my grandma's personality at all, but that was a decision that she made.
Yeah. But it's that thing that, we always talk about. The mind and the body are not separate entities. And if the body is failing and the mind decides enough, I think that's it. It's a degree of inevitability, isn't it? Often, not
And it's,
always, but
and
often
it's
I think
really,
it. Um, but I think that's where we are lucky in terms of lucky. I don't think it's the right word, but you'll know what I mean. Um, Having the option to be able to intervene if we think the suffering is too great, or if we think the quality of life is poor without Because the thing is, we can have a serious injury or a serious illness, and we can think, okay, I'm going through this treatment and this treatment's going to be really unpleasant, but that's okay because there's a fairly good chance that the outcome at the end of it will mean that I have some quality of life afterwards, in whatever way that takes shape.
Yeah.
But the animal can't possibly know that. That was another thing I really struggled with Mary. Another episode of her life, when not going into the backstory, but she ended up on box rest for 3 months. Um, and she was not a horse that liked to be stabled. Like, she really didn't like to be stabled. And she was not allowed out of that essentially prison cell for 3 months. Now, for me, I can think, well, that's okay because I know at the end of the 3 months, she's going to have had this rest and this treatment, and the chances are that her outcome is going to be good. But for her, she's living that moment every day with no understanding of when it's ever going to come to an end, and doesn't have the ability to say, yeah, okay, I'm willing to sacrifice for that good outcome, or actually, no thanks, I don't want to do that. So we have to be the one that makes that choice. And it can be really freaking hard to know, particularly when you're really emotionally involved. You really love the animal.
Yeah.
It's really hard.
And I don't think, as long as we choose a point where they have dignity
Yeah,
and they're not suffering,
yeah.
I don't think there's a right or wrong way to do it.
No. No, it's a very individual thing, isn't it?
Yeah, and like with everything, it's so nuanced, there's so much context and so many factors to consider to something like that.
Yeah, I mean oh God, there's so many facets and like ethical considerations, aren't there? I mean, veterinary medicine is a wonderful thing. Like,
Oh, for sure.
it's a wonderful thing. Um, but sometimes, and I think insurance can be a great thing, but it can also, it's always this thing of, does the thing drive the behavior you expect, or does it create these anomalies? And I think there is a risk that because so many animals are insured now, that there is potential for things to be done because they can be done that are not necessarily in the animal's individual best interest, like in terms of their quality of life and their experience of life. But it's it's kind of soothing for the human because they get to keep that animal there for longer. But
Yes.
I think that it's such a difficult one, isn't it?
It's like a short-term fix for long-term suffering
Potentially, yeah. Yeah.
because we know this from seeing so many horses that their bodies are broken or breaking,
Mm.
and that
Just keep putting
medicating
the
for the
steroid
wrong.
injections in, like just
Yes.
steroid injections. They definitely, like, don't get me wrong, I'm not saying never use steroid injections. They certainly have a place, but again, I think it's a tricky one. There's a time and a place, but there's
Yes.
also, you know, when it's used, in my opinion, excessively and inappropriately.
Yes, because the body is always going to compensate. And what needs to come, and this is super important, what needs to come with pain management or medication is the right supportive rehabilitation program, emotionally and physically.
Mm.
Not just a standard discharge program of here's 6 weeks of pole work, do these. Because pole
Yeah.
work themselves, if we're obviously staying on theme with horses here, can be, can be a massive contradiction to what you're trying to achieve.
Yeah.
But I think that's definitely still an element that needs some work in terms
Yeah.
of wanting the two together.
Yeah. Yeah. It's not a straightforward. And if these things were straightforward and simple, there'd be clear rules and guidelines in place that everyone was comfortable with. That's
It brings you back to that age-old quote of just because we can doesn't mean we should.
yeah, absolutely. Absolutely. Yeah. So with your turning the conversation to something slightly different, with your sort of knowledge of horses and horse behavior, I know that it's often said that it's good to allow, if your horse has been in a herd, it's good to allow the other horses to come and see the horse that has deceased before it gets taken away. What are your thoughts on that?
So I'm of the mindset that if you can allow a horse to see the body,
Mm,
then to let them see.
yeah.
Because when it comes to death and grief, yes, we experience it and we feel it so deeply,
Mm,
but we also need, and this is something that we need to do, we need to be able to see it from the perspective of the horse and go, how are they also going to feel about this situation? If you've got a best mate that you text every day and then all of a sudden they're
mm,
just beamed up into space, you never hear from them again.
mm,
There's so many thoughts, so many feelings that go through for a person.
yeah.
For a horse who is more of a feeling animal,
Yeah.
they grow up together in a herd or they form certain attachment
Yeah.
bonds with each other. They need time to process and they need time to know.
Yeah. And I think that's something we can do to actually help. But that's just while you were talking there, it got me thinking, like,
That's what you're thinking there.
yeah, literally cogs turning. Um, eh, grief is not grief is not just about death, is it? But it's also it's about loss. It's the loss.
Hmm.
So horses are constantly being moved around from yard to yard. Like that's it's the same thing.
Hmm. You can grieve for someone who is still here.
Exactly. You have a relationship and you split up and maybe you're not the person who wanted the relationship to end. You're going to grieve for that relationship and for that person even though they're still walking around. But for the horse,
Completely.
they all they know is that their friend was there and then suddenly they've disappeared. And I don't know, like maybe I'm overthinking this and maybe it's but do you think that do horses have the capacity, do you think, for it then to affect future attachments?
Yes. Oh, completely. Yes. So, So, in my experience, regardless if you look at grief as death or grief as loss, it can affect their attachment style, but it will certainly affect their behavior.
That's very interesting. Yeah.
Whether it's a secure attachment, whether it's an anxious attachment, we have, as people, very similar attachment styles.
Oh, really?
Yes. Yes.
That's very interesting.
If you have secure attachment style, that's obviously quite healthy. But if you have another attachment style, one that isn't secure, such as anxious attachment or avoidant attachment, then there's going to be behavioral presentations that develop as a result, such as, we quite commonly will see separation anxiety, hypervigilance, elevated arousal levels, digestive issues. I mean, there's a multitude of different ways that these can manifest, and your attachment style will be affected regardless of if this was through death or through loss.
Yeah.
And the amount of horses that are moved around on a day-to-day basis where we don't give any thought really
Yeah.
to actually
Yeah.
how deeply their bonds form
Yeah.
and what that might do later on in life. You know, as an example, we know that early weaning and how that is done with
Do you
mares
know,
and foals.
I was just thinking weaning, like, I would say probably, I mean, it must be well over 90% of horses, domestic horses, have gone through that. And that, just to say, that's a figure I've pulled out of the air there. So if anyone knows better and wants to correct me, then feel free. But that go through that kind of really dramatic, traumatic weaning process of just
Yeah.
mother and foal being ripped away from each other.
And it is a trauma. And it's, there's been so many studies out there that foals that are effectively ripped away from mum, they develop anxious attachment styles as they get older. They are more inclined to be more sensitive, experience more elevated arousal states.
Yeah. Yeah.
And we're the same. We're very similar in that sense. I think I remember reading about a study on babies. Was it yeah, it was a study or an experiment on babies a while ago. I can't remember. I can't remember the concept of it. I'll have to fish it out and have a reread actually. But they talked about how long the parent figure had left the room and how the baby then responded.
Yes, yes, I'm vaguely aware of. Yeah, yeah. I'll to dig that out. Yeah, I was listening. Funny enough, I was listening to a podcast recently where they referenced that study.
Oh, really?
Yeah, but I can't remember the detail of it.
I can't remember the details off the top of my head, but it was a really interesting one.
Yeah, it was. We'll have to try and dig that out and have a refresh on what that was about. But yeah, I mean, I feel like it has to have.
Because you've got avoidant attachment. So I'm trying to think of all the
Yeah,
attachment styles in the middle of this topic of conversation, but your avoidant attachment is when you become self-reliant.
yes, I have an avoidant attachment.
I know.
That
That
comes
wasn't
as
my
no
place to
surprise
say
you
that.
whatsoever. Yeah. Yeah. Is it any wonder I'm single?
um, yeah, you've obviously you've got that. The other one will come to me. You've got about 4 or 5 different attachment
Yeah,
styles.
yeah,
So, they all manifest through levels of grief and trauma.
yeah. And that trauma stays trapped in the nervous system and can manifest for life.
Yeah, and I think that's why, regardless of the grief that you're experiencing, whether you are identifying it in yourself or able to identify it in horses, dogs as well, because, so many times we have the dogs, they live with us. We usually have, more than one.
Yeah.
We take one to the vets because it's their time. And does the other dog know?
No,
You know,
I remember very clearly I had a little dog Fudge, a little terrier, and then I got Sadie. So Sadie came as a puppy and her life therefore was Fudge. She didn't know anything any different. And then he was only I think he was only 9. He was only still a young dog, particularly for a terrier. But long story short, he had a big tumor, and took him to emergency vet late. We'd been going to take him to Newmarket, but as things happened, it all happened a lot more quickly, and took him to the emergency vet one weekend, and he didn't come home. But it took her, like, it really, it was awful seeing how distraught Sadie was at having lost her friend, because that's all she'd known, and she was looking for him, and she was really depressed, and yeah, it was really, really sad. Um,
How did she respond?
um, she would literally be looking for him, um, and she was just really flat. Went off her food a bit, and it lasted. I mean, it kind of tapered off, but it lasted a good couple of weeks, really.
And it's really interesting you say that because the same sort of behaviors that you're describing that Sadie showed
Mm,
can be exhibited in horses that have experienced grief
mm,
through death or loss.
mm,
They can become slightly depressive. Um, a lot of the time, they become a lot more hypervigilant and their
mm.
state of arousal goes up. But interestingly, the state of arousal, the state of arousal is greater if the horses don't see the bodies.
Oh, really?
Hmm.
Yeah.
Yeah,
But then, yes, I mean, and I guess that makes sense because if you think about it, that if the horse just disappears, that's got to be incredibly stressful.
yeah,
Whereas, um, I've been present, unfortunately, for a number of horses being put to sleep, some of my own and some of other people's. Um, and it's very clear that the other horses understand when they're able to go up, and they respond in different ways. Um, but it's clear that they are able to understand what's happened. Whereas if a horse just disappears, because if you think from evolutionary terms, having a herd, like a stable herd, is really important to survival. So if suddenly one of your herd mates just disappears, that's going to be really destabilizing.
yeah. And I think once you see those kind of situations and you experience them for yourself,
Mm,
I don't think you can then question what science hasn't proven yet that
yeah,
we can see with our own eyes.
yeah,
I remember a friend's horse was was euthanized probably about 2 years ago now. Um, and she had she had her put to sleep in sort of like a small little paddock, but in sight of the others. And she
yeah,
she went she went down very peacefully, but that she was in a herd of three, and one of the other horses in the herd of three stood by the gate watching as it happened, and then after she'd been down after she'd been down about, I think maybe a very short period of time, she looked at the body and then looked and followed something up to the sky.
really,
It was like she was following something leave.
yeah,
And my friend described that there was nothing else that she could be tracking so intently.
mm,
Because she's not that horse isn't a sky gazer. She's not a stargazer, that horse.
no,
So I think there are certain things which some of us are tuned into and some of
mm,
us have awareness of from being in those situations, even if we can't explain them. But there's a lot more to this process that we need to consider
mm,
than just the practical sides of how and when.
yeah, yeah, yeah. Yeah, very much so.
Because I think, we've had this conversation before. Is it better to know
Yeah.
when the time is coming, or is it better for the decision to be taken away from us? But I think saying that depends on the context of the situation, because a lot of the time
Yeah,
when
it's
it's
really
taken out of
tough,
our
isn't it?
hands, it's usually something which is quite traumatic all around,
Yeah.
and a way in which you would never have wanted them to go. But I know from personal experience, I mean, obviously, we know from personal experience, sorry, that knowing when the time's coming, I feel can be harder for
Mm,
us as people. You know, the dogs don't know. They might be able to sense some things a little bit different, which I'm sure they will, but they may not necessarily know, but we know.
mm. Yeah,
And
yeah,
we have that, we're effectively grieving to an extent before,
yeah.
which I think can be quite hard on the mind and the body.
Yeah, it's really I don't know what I don't have an answer to that.
I think it varies between
It,
people.
yeah, and I mean having had animals in both those situations, um I feel like so Sam, my German Shepherd, had a gastric torsion, and that was when I had him put to sleep. And I mean, it was, I took one look at him and was like, "You've got to get to the vets right now, mate. This is not good." And I knew what was coming, and it was, but it all happened very quickly. Um, and uh, but he, for that short amount of time between getting him in the car and getting him to the vets and them assessing him, he was in a lot of pain. So that was, and I those images are imprinted in my brain and forever will be. Um, whereas I I've had horses that I've had to select a date when I was going to have them put to sleep. Rosie, another lovely thoroughbred that I had, I'd decided a date for her to be put to sleep, and for her, she didn't really like. She had problems, but they were things that were going to get dramatically worse and were going to cause her a lot more problems. And I decided with her it was better to let her go while she still had some really good quality of life. Um, so she didn't know, and I did question myself quite a lot in the lead up to it. But I think in reflecting back, that was an easier situation to deal with because I knew that it was the right choice for her, and I knew that she wasn't really suffering at the point that it happened. So it was really hard letting her go, but I felt like I was doing right by her and that she wasn't really suffering at the time. Whereas with Sam, it kind of came, I mean, it was the second episode that he'd had, so it wasn't completely out of the blue, but it was like a couple of hours and it was over. But those couple of hours, he really suffered. That one I find more difficult to deal with than the one where I'd made a plan. But you don't always get the choice. This is the thing, do you? It's not, we can sit here and say which is better, but you don't get the choice
Mm.
always. The emergency thing is going to happen whether you like it or not. You don't get to choose over that, and you just deal with it the best way you can. I think you have to be there for the animal, and I in any situations where I've been there with an animal that's been being put to sleep, I've always tried really hard, although you can't mask it, but I've always tried really hard to hold the tsunami of emotion back until the animal is gone so that they're not having to deal with that. and to try and be there and be supportive for them up until the end. And then once they've gone, then it all comes out. That's for me how I've always tried to deal with it. But yeah.
I remember I remember the first one of the dogs that's
Yeah, I remember the first dog that we had put to sleep. So when me and Tash
we hadn't been together long. We adopted a we thought he was well, we was told he was seven.
Mm.
7-year-old Rotty.
called Apollo, and we had him 6 weeks,
Oh, bless him.
and the vets had not identified he had an issue with his heart,
Right.
which was glaringly obvious when we took him to our vets.
Right.
And we lost him 6 weeks later. And I remember going into the vets, and he was just flumped out on the floor.
Mm.
Because
I think he was filling up with fluid as well. He was sort of head on the floor with his front feet splayed, which is what they do.
Yeah. Yeah.
Um, and that completely broke me because he hadn't shown any enthusiasm until I got there, and he wagged his little
Oh,
stump
oh,
and poked
bless
his
him.
head up, and yeah, that
Absolutely broke me.
but
But think of the comfort you gave him in that moment.
yes, and it's not about yes, we have to consider how we healthily can work through grief,
Yeah.
but I think we also have to be quite selfless in these situations and think about the being that we're there to support too, and make that
Yeah.
transition as easy as possible. And I
Yeah. And
know
at the
that
end of
looks
the day,
differently.
you take on an animal, the the greater chance is that you are going to outlive that animal. Like, unless things go horribly wrong, the chances are you are going to outlive that animal. So you choose to take on the animal. That is your last act of love and kindness and responsibility to that animal.
Yeah.
I have a friend who's a vet, and we have this conversation from time to time.
She's relayed, and we have quite an open, honest conversation
About it,
Mm,
how sometimes when
it comes to that time where
mm,
owners will effectively hand their animal over to the vets and then leave.
mm,
Now, she says in some situations the owners can make the situation more stressful for the animal,
mm-hmm,
but personally, and of course, no judgment, personally, I could not just go here.
mm,
If I can be with them, I'd want to be with them.
mm,
And I've been with a handful of clients when they've had their horses put to sleep.
mm.
And that's something if regardless whether I've worked with someone for a couple of months or I've worked with them for 5 years, that's something that I will always offer because that horse has been part of my life as well.
Yeah,
You
yeah,
form
yeah,
relationships. So if I can be there in any way to support, I don't see it as about me. Yes, it comes with emotional weight, but if I can support the horse and I can help support that person in any way, I'll do it.
yeah, yeah. I think it's, I can't imagine not being with one of my animals at the end. Obviously assuming opportunity allowed. Um, but similarly, I have been with other people's horses before. And the owner has been there and come and said their goodbyes. And then I've stayed with the horse for the actual moment. Um, and I felt okay about that because it was a horse that I had known for a long time and I had a good relationship with. So I felt like it wasn't the last image that the owner needed to have of the horse. Um, and that actually it wasn't doing the horse a disservice because th there was still someone there that they had a bond and a relationship with. It wasn't just leaving them with a stranger. Do you know what I mean?
Yeah.
Um, it's really difficult, isn't it? It's really difficult.
I remember when we're doing a lot of reminiscing here. I
Mm,
remember when Tash had to have Jazz put to sleep, and I think I was when she went, I was quite distraught. Um, Obviously Tash was, but
mm,
I remember it was one of those moments where when you just can't quite believe it,
yeah,
and you want to do something to bring them back.
yeah,
I I, I remember that so vividly, and that's actually I'm going through moments of that at the moment.
yeah,
But
yeah.
I'm obviously
But
allowing
that's that
myself to.
denial phase, isn't it? You know?
Yes, yes. So it's quite interesting to kind of place place the experience given that five stages. Um, but there is something about when you're with the body when they've passed, knowing that it's and not knowing, feeling it's a vessel.
Mm,
I don't know about
mm,
you, and I don't know obviously about anyone listening, but after when the time's happened and you're there with the body, I don't
mm,
feel anything from the body. I feel often them leave,
mm,
which is a very, which can be a very peculiar feeling.
mm,
And I actually remember the night after Jazz had passed, she came into my mind like that, and then I just got a really, really strong, overwhelming sense of peace. And that didn't come from me, that came from elsewhere. So I think that
yeah,
was clarity enough that the decision was right.
yeah, yeah, yeah. Mm,
But I think it's important no matter what the situation, we have to support, deal with, work through, however you want to word it, that we move through it healthily and when we allow ourselves to do it.
yeah, yeah,
Because I think too many times with emotion, we don't allow ourselves to feel it. Like I said to you
yeah,
before we started recording, I'm like, if I cry, we're carrying on recording
yeah,
because actually I would rather talk through tears
yeah,
because I don't want to stop the tears from coming because they're coming for a reason and I want to
yeah,
be able to feel
absolutely.
that emotion.
Yeah, yeah,
And I'm not saying everyone needs to sit there and have a good cry, but crying is healthy. Feeling
yeah.
angry is healthy.
Well, it's part of the processing, isn't it? You know, your
Yes.
nervous system and your body and your mind and everything needs to come to terms with the change.
And the things that have actually worked for me are just really the simple things because we know that grief and emotions can get stuck in the body in
Mm.
certain ways. We know that muscle memory and emotional memory attach within the body. So, what I've actually found really beneficial over the past couple of days is gentle movement.
Yeah,
Even if I
yeah,
don't feel like it,
yeah,
just anything that is good for regulating your nervous system, walking, yoga,
yeah,
stretching,
yeah,
swimming, anything that is gentle, you don't have to do too much. I found that to be really beneficial because it helps to move whatever's sitting in your body through while your mind does its
yeah.
part.
Does its processing. Yeah, yeah, yeah. I think that's a really important point. And I feel like we've kind of gone through a few things today. It's it's a really
Feels a bit
tricky
weighty
one.
now, doesn't it?
Yeah, but I think that's okay, you know. Not
Yeah.
everything has to be not everything has to be light.
Not everything can be light.
No, exactly. Exactly. And in some ways, those things, when they happen, it acts as a juxtaposition for the good stuff and helps to, helps kind of shine a spotlight on good things
Yeah.
and a reset for appreciation.
Yes. And
As hard as passing over is for those that have left, for those of us that are left behind, I think you can always celebrate them in small ways or big ways, however you want to do that.
Yeah.
Because grief is just love in a different form.
Yeah. 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 Well, there we go. I feel like that might be that might be the Ross Cooper ends to the podcast statement. And that
Nailed
one
it
just
again.
rolled off the tongue naturally.
Right. Well, thank you very much for joining us, and thank you very much for listening into this. I'm sure this may have not been an easy listen, but like we say, sometimes it's the conversations that need to be heard, and we sometimes need to have these kinds of conversations.
Absolutely. And I think, yeah, the more that we can talk about things, the better, really. I think other cultures, some other cultures are much better at it than we are, but I think it's something, we can aim to do to support our animals, support each other.
Support ourselves.
Indeed.
Yes.
Yeah.
right. On that note, thank you for listening, everyone. I hope you've all taken something away from that, and we'll be back in 2 weeks' time with the next episode.
See you
Thank
soon.
you very much. Bye.